Hello, my name's Stephen. I'm an upper GI cancer clinical nurse specialist at Hampshire Hospitals. When somebody's first diagnosed with cancer, we're usually present there to support them, and actually someone who's diagnosed with cancer will require lots of different help from lots of different people, and a large part of our job is to be in the middle of that and actually make sure that they get the help, assistance and care they need from the right people at the right time. It's a very varied role. I would say it's being a resource of information for the patients. It is being a first point of contact for patients as well. It's being the sort of person that supports them all the way through their cancer journey. Some of the main tasks I do are attending clinics. So we sit in on many of the oncology clinics, and we're there in a supportive role for the patient. Also, we go and see patients who are actually having their treatments, so we sort of catch up with them on a regular basis. And we do these things called holistic needs assessments. It's so varied. You think that you've got your day planned and the phone rings, and then all of a sudden you've got someone actually in their home who needs your help. I would say, obviously, the variety of learning that's necessary and on offer. There are so many different things that you actually need to know about, from the purely medical all the way through to the holistic. So I find that very satisfying, actually. There are times where a patient will call or we'll see them in the ward while they're having their treatment, assess them and actually really open the door to lots of things that could help them that they otherwise wouldn't have known about. And obviously they're in a situation that's probably the most scary thing that's ever happened to them in their lives. And actually we're able to make that somewhat better, and for them to know that there is somebody there who is purely on their side. And so kind of knowing that and having certain days where I know that what we've done has actually made someone feel a lot better is very satisfying. When I qualified as a nurse, I initially went to elderly care, which is where I sort of thought I wanted to be, and gained a lot of really valuable skills from that. I then was a bank nurse, which basically meant I could work wherever I wanted to work, and again was able to kind of just look around me and see where I wanted to go. I ended up in endoscopy, which was fascinating because it was actually directly with cameras directly looking at your insides, really, so at the upper GI tract and the lower GI tract. While working in endoscopy, I gained management experience, I did leadership courses, and I also did communication courses. And actually that is vital for a job like this, because you're communicating with patients, again, who might be in some emotional distress, might have lots of questions, might find it difficult to process information. So good communication skills, I think, are really key for a job such as this.